Welcome everyone. Thank you for joining us for the October National Farm to School Network topical webinar, results from the 2018 National Farm to Early Care and Education Survey. We're going to give it just one moment for everyone to jump on the line and then we'll get started. Thanks for your patience. Welcome. Thank you so much for joining us for the October National Farm to School Network topical webinar, results from the 2018 National Farm to Early Care and Education Survey. My name is Lacey Stevens and I'm the Program Manager with the National Farm to School Network, and we welcome you. A few housekeeping reminders before we get started. This webinar will be recorded and archived for future viewing. You'll receive a link to that recording in a follow-up email, along with many of the resources that we talk about today. All attendees are in listen-only mode. As you do have questions, and we hope you have questions for us today, please feel free to enter those into the question box on your control panel. We'll have plenty of time for question and answers with our panelists at the end of the session today. We do hold these webinars on a monthly basis, so please mark your calendars for our next webinar on Thursday, November 1st, where we hear from members of the National Farm to School Network Seed Change in Native Communities cohort as we honor Native American Heritage Month in November. So please join us for those upcoming webinars. And before we get started on our Farm to ECE topic for today, I want to celebrate with you. October is a very special time for Farm to School and Farm to Early Care and Education. It's National Farm to School Month. And in National Farm to School Month, we take the time to celebrate all those connections that are happening all over the country between children and local food. It's a great time to start or expand your Farm to School or Farm to Early Care and Education activities. The National Farm to School Network was part of a coalition that advocated for the creation of National Farm to School Month, and it was designated by Congress in 2010. And since that time, we organize this annual celebration every October in partnership with many other organizations across the country to help raise the conversation and educate more people about the benefits of farm to school and farm to early care and education. So we have lots of great ways to help you get involved and get engaged in addition to joining this webinar for National Farm to School Month. At the National Farm to School Network, we'll be sharing inspiring stories of farm to school and ECE innovations and success on our webinar. Like this one, we'll be encouraging folks to learn about Farm to ECE on our blogs and through all of our social media. And we'll ask you to tell us what you're doing this October to celebrate. So check out our national calendar of Farm to School Month events for ideas about how you can celebrate within your own state and locale. And join us by taking the Take Action Pledge and tell us how you're celebrating Farm to School Month. Everyone who enters the pledge is entered to win our sweepstakes for a package of farm to school prizes for your school or ECE site. So join us and tell us what activities you're taking this October. So now let's all celebrate together by digging into the results of the National Farm to Early Care and Education Survey. We'll start with a quick introduction to the National Farm to School Network for those of you who are joining us on these webinars for the first time, and a quick introduction to our partner in conducting this survey, Michigan State University Center for Regional Food Systems. Then we'll share the process and highlight our findings from this year's National Farm to Early Care and Education Survey, and dig into discussing how you can put these results to work to advance farm to ECE at the state and national level. And then finally, we will have some time for questions and answers. So please continue to enter your questions into the chat box as we move through our session today. And we'll have lots of time for a great discussion at the end. To put some faces to names, I'd like to quickly introduce you to who you'll be hearing from today. As I mentioned, my name is Lacey Stevens, and I'm a Program Manager with the National Farm to School Network. In my role at NFSN, I work to promote the expansion of the Farm to Early Care and Education movement through information sharing, network building, and advocacy at the national, state, and local levels. I'm a registered dietitian with a master's degree in sustainable food systems, and I'm based in Bozeman, Montana. I'm also very pleased to have with us today Megan Shedd. Megan's assistant professor, farm to early care and K-12 education with Michigan State University Center for Regional Food Systems. Megan works with early childhood educators in K-12 education settings to increase access to locally grown and affordable foods. Megan has a BS in dietetics with a specialization in health promotion, an MS in community services, and a PhD in educational psychology and educational technology, all from Michigan State University. And now for a quick introduction to the organizations involved in this year's survey. The National Farm to School Network is an information, advocacy, and networking hub for communities working to bring local food sourcing, school gardens, and food and agriculture education into schools and early care and education settings. The National Farm to School Network provides vision, leadership, and support at the state, regional, and national levels to connect and expand the farm to school and farm to early care and education movements. And as you can see here, we really are built on this network structure. In addition to our national staff and advisory board, we have what we call our core and supporting partners in every state, Washington, D.C., and several of the U.S. territories. And these are those folks that are really leading the way within their state in farm to school and farm to ECE. We also have over 20,000 network members, hopefully including many of you, across the country who represent the whole spectrum of farm to school and ECE advocates and partners. And I'm going to turn it over to Megan to tell us a little bit about MSU's Center for Regional Food Systems.
Thanks, Lacey. At the Michigan State University Center for Regional Food Systems, our vision is a thriving economy, equity, and sustainability for Michigan, but also the country and our planet. And that involves food systems rooted in local regions and centered on good food, or food that is healthy, green, fair, and affordable. We also like to think about helping people and organizations working to improve the food system to be more effective. And that includes growers, processors, thinking about aggregation and distribution, entrepreneurs, and an institutional food service. We also produce applied research and educational materials to help inform advocates, educators, and decision makers. Just like the National Foods School Network, we involve networks and networking, which are at the heart of our work with all of these groups. The bulk of our work is at the state level, but we also engage with collaborating partners in some important national benchmarking studies, and we're a core partner in the National Farm to School Network. This has led to the opportunity to partner with NSFN with the 2018 Farm to Early Care and Educator Farm to ECE survey, which we're talking about today.
Great, thanks Megan. As you can see, it was a great fit for the two of our organizations to partner to work on this national level survey. And now on to our survey. So before we could start digging into the results, I wanted to share with you some of the resources that you can go back to learn more about these results and also be able to share these results out with your network. So we have an incredible fact sheet, an infographic, social media graphics, and a sharing toolkit. And I'll give you a little sneak peek of what those look like now. All of these are available on the National Farm to School Network website at farmtoschool.org/ECE. And you'll also receive links in the follow-up email where you get the recording of this webinar as well. So just a preview of what those great resources look like. So we've got this multi-page fact sheet that really gives these high-level results of this survey and will help you share out and start those conversations about farm to ECE in your communities and networks. We also have this infographic that provides a visual, engaging way to share this data through social media as well as with your stakeholders. And here's a peek at those social media graphics that are perfect for Facebook or Twitter to help lift up farm to ECE. And these are all available to you through our sharing toolkit as well. In addition to these resources that are available now, we are also planning a release of a full expanded report that provides more in-depth detail about the survey results, along with state-level data in early November. So that is in the works, and keep an eye out for that. We'll be giving you a sneak peek of those results as Megan presents today. So to provide a little contextual background about how we got to this 2018 survey, we're really building on these two previous surveys conducted in 2012 and 2015. This initial 2012 Farm to Preschool, as that we called it at the time, survey was conducted by our partners at EcoTrust in partnership with the National Farm to Preschool Subcommittee. We had about 500 responses included in the data from this survey, and that included only programs already participating in Farm to ECE, but we did get a scope of what the barriers, challenges, and activities that were happening during that time. That led us to the 2015 survey that was conducted by the National Farm to School Network with support of the Farm to ECE Working Group. Like the 2012 survey, the 2015 survey used a snowball sampling dissemination to capture as many responses from across the country as we could. We had about 1,500 responses from states across the country that helped us understand, again, what that scope and reach and current activity level of Farm to ECE was. So we built on what we learned from these two existing surveys for the 2018 Farm to Early Care and Education survey. Like the previous surveys, our aims for the 2018 survey were to better understand the scope and reach of Farm to ECE across the country. And that included who's participating, both understanding the geographic elements as well as by type of early care and education setting. We also wanted to learn about what types of activities were happening across the country. What were the motivations as well as the barriers to participation in Farm to ECE? And finally, better understand what are the existing resources that people are utilizing and where are the support and needs to help expand Farm to Early Care and Education participation and the Farm to Early Care and Education movement. So with that, I'd like to turn it over to Megan to help us dig into the methodology and the findings from the 2018 survey.
Thanks, Lacey. So what was different about the 2018 survey compared to the previous versions in 2012 and 2015 was that this version utilized a purposive sample. So we wanted to invite a representative sample of early care and education providers to participate in the survey, and this would give us a better perspective of the activities, motivations for implementation, and barriers to Farm to ECE among a variety of types of providers. And this list of providers included licensed and license exempt providers, as well as those providing care in family-based and center-based settings, schools, Head Start and early Head Start, and tribal settings. One of the limitations is that we also learned that there's some fragmentation within the early care and education system. So what we learned is that there's a lack of publicly available means of communicating with ECE providers. And that's just something that we can talk about in the discussion as well. We sent a total of 64,402 emails distributed across all of the states and U.S. territories, and those were sent directly to providers or through their child care resource and referral or Head Start collaboration office emails, which were later disseminated through those offices with a link to the survey, which was disseminated through Qualtrics. We got 2,655 sites responding to the survey, which is a return rate of about 4%. Of those who responded, we had 2,030 surveys that were deemed usable by our research team. And we figured that a response was usable if they answered 75% of the demographic questions and answered questions about their site's activities, even if they didn't respond to the questions about barriers or motivation. So we collected the data, cleaned all of that data to eliminate duplications, remove partial or invalid responses, and analyzed it using SPSS. About 740 respondents described their settings as childcare centers, so that's about 36.5%. We had another 35%, or about 711, describing themselves as licensed family childcare. About almost 18.5% were private preschools, 12% were Head Start or early Head Start, and 11 were unlicensed family childcare or license exempt. When we break it down in terms of the age of the children for whom they were providing care, just over half were caring for infants, 3/4 were providing care for toddlers, and almost all of them had preschoolers in their programs. And if you're doing some quick math in your head, that clearly doesn't add up to 100%, but remember that in early care and education, there's multi-age care that is in each of those particular settings. So let's check out the next slide. And so again, you can see some of that same data in terms of that number, 2,030, just so you can see that number. Again, a little over 64,000 emails were distributed, but we had a response of usable data of 2,000. 46 states responded, and of the responses, just under half indicated that they were engaging in farm to early care and education activities within the last year. What's important is that of those, even though we had half of them saying that they were engaging currently in farm to ECE activities, almost a third intended to start implementing farm to EC activities in the future. So we'll keep that data in mind as we continue as well. So we're starting to see some trajectory in terms of what's happening and what's going to happen in the future. We also looked at some demographic data too in terms of free and reduced price meal eligibility. So looking at the number of sites where 50% or more of the children were eligible for free or reduced price meal, and just over a third of those sites indicated that they were serving children in that for that particular program. Let's look at the next slide. So we also wanted to know how many of these sites, for how long they've been engaging in farm to ECE activity. And a third of them have been doing this for over 5 years, which was pretty exciting to see. We noticed too that 4.4% had been engaged in farm to EC activities in just the last year, but almost a third had been doing this for between 1 and 3 years, and then 14.5, almost 15%, had been at least 3 but less than 5 years. So for those who responded to the survey and had been participating in farm to ECE activities, there's some longevity in terms of how long they've been doing this. When we look at the top 3 farm to ECE activities, and remember this is just for people who are engaged in farm to early care and education activities, the top activities in which they are engaging, 76% indicated that they are engaging children about locally grown food, how food grows, and or where it comes from. Planting or working with children in an edible garden was indicated by 75% of respondents, and serving locally grown food in meals, snacks, or taste tests was reported by 68.9%. Let's take a peek at the next one. So remember, we're also interested in what's motivating participants to engage in these farm to early care and education activities. So not only what they're doing, but why they're doing it. And these numbers are fairly high as well. So participants could indicate more than one reason. And so that's important to take note of as well. So teaching children about where food comes from and how it is grown was reported by 95.5%. Improving children's health was also up there at the top. And providing children with experiential learning opportunities was also reported by 94.9%. So for the purpose of this webinar, we're not sharing the different curricula that were reported by providers, and that was a pretty big swath of curricula that was reported, and that will be released in the public-facing results that Lacey has also talked about as being released in November. But those experiential learning opportunities at nearly 95% was also really important to providers. And next slide, Lacey. So we asked providers to give a definition of local, or what local means to them. And they have a selection of geographical choices to which they can respond. So same city or county, within a 50-mile radius within the state. And what was interesting here is that 35.3% were saying that local for them was in the same city or county. 25.3% defined local as within a 50-mile radius, and 19.2% were defining local as within the state. And that number of respondents was 717. So remember, not everyone had to answer every question, and that's consistent with IRB protocol. But for those who did respond, local was a pretty tight geographic area. We also asked about direct and intermediate sources. So direct would be like from the farmer or a farmer's market. And so this number again was 717 respondents, and 1/3 of those who were responding to this question purchased food directly from farmers markets. Other sources included procurement from on-site or community gardens, and that was 30.8%. Or getting food from individual farmers or producers at 20.8%. Intermediate sources, which would be like a grocery store or a retail outlet. This might also include food banks or school systems that were listed as specific examples. And early care and education sites actually were most likely to list other, and that was listed at 74.3%. What we found is that when they listed other, they would then go back in and include the specific examples, which would often be a specific name of a grocery store or a retail outlet. So even though we would have 17.4% of respondents indicating a distributor and 8.9% indicated grocery stores or retail outlets, 8.1% said food processors or manufacturers, that other is a 3/4 of them are indicating other. When we go back in and look at those specific names, they would list the grocery store or retail outlet. And so that's an interesting finding to go back in and take note of. When we look at frequently served local products, milk is the most frequently served local product, and 21.7% of respondents reported local milk was served daily, which makes sense when we think about CACFP, or Child and Adult Care Food Program participation, and also milk being served with snacks and milk in general. Fruit at 14.2% and vegetables at 14% were the next most frequently served food types. And again, this is among respondents who indicated that they procure local products as part of meals and snacks. So we want to make sure that we're being very careful about who is responding to these questions when we're talking about these results. When we were looking at barriers to procuring local products, the cost of items emerged as the most frequently cited barrier to purchasing or procuring local products, and 67.5% of respondents indicated that cost was a barrier. This question again allowed participants to cite multiple barriers, and so we can see that the numbers here won't add up to 100% because participants could respond to or indicate multiple barriers. Seasonality of fruits and vegetables was a barrier for 64.7% of respondents, and that was followed by reliability of product supply. Nearly half of, over half of participants indicated that at 54.4%. Finding suppliers or farmers to provide local food, 54.1% of respondents indicated that that was a barrier, and just under half of participants at 49.5% indicated that knowing how to order local items, that was a barrier for them. So those were the top 5 barriers among our participants. Let's take a look at the next slide. So when we start to think about this in terms of, these are some fairly straightforward results in terms of descriptive results and just what the data is saying from a straightforward aspect. But we've already alluded to the fact that this was a purposive sample, and it was the first time the survey was conducted in this way. And so one of the things that we noticed pretty soon was that the early childhood education system is fairly fragmented in terms of communicating with providers. So for some states, we were able to access through different avenues, emails to directly communicate with providers. In other states, we had to go through child care resource and referral or different offices. And so those offices were disseminating the link to providers. So that fragmentation, even though this methodology is increasing the rigor of the study, we do wonder in terms of, did all of the providers have equal opportunity to complete the survey? And it makes it difficult, if not impossible, to compare to previous versions of the survey. So one of the things that feels really important in that respect is to utilize a similar methodology in the next version to enable comparisons and look at change and growth at different time points. It also speaks to the need for collaboration with federal and state agencies to reach potential participants to engage in the research. And that's probably one of the most important things that we would say in terms of data collection, that need for collaboration at federal and state levels with this particular type of research. In terms of aligning with early care and education priorities, it became clear just from these descriptive data results that improving children's health matters, and that was a primary motivation. Education in gardens, the other top motivators and top 2 reported activities, align with 2 of the 3 core elements of Farm to ECE, and they also align with indicators of high quality early care and education environments and approaches to experiential education. What's notable here is that curricula, especially research and evidence-based curricula, can help implement nutrition education activities. So as we see farms to early care and education grow, greater demand should result in that shift to support sustainability in terms of practices, but also empowerment of providers. So we might start to see a culture shift there as well. And we also often see in early care and education conversations around wages and support for workforce. So here we might see some juxtaposition in terms of prioritization of health and importance of high quality meals as well. So remember that cost was that big barrier, and cost was the barrier in terms of procurement, and we didn't talk about some of the other barriers that were identified, but funding for supplies, cost of products, those emerged as top barriers overall. And so, well, this could be addressed through formal early care and education policies, limited staff knowledge about gardening and local foods to address procurement practice, and as a result, cost can take place through informal policy. What's also interesting to note is that limited staff time was also identified as a barrier, and as a former early care and education provider, that makes sense to me. So if we think about this idea of multitasking, this could be addressed by integrating farm to ECE principles and education into existing trainings. And we know that that's already taking place in some states, but also at a national level. That feels super important here. We can also address some of the barriers around procurement by tapping into existing resources, things like existing suppliers, training and technical assistance, and networks that are currently in existence that can be extended and modified for different types of providers. And that last piece feels especially important, different types of providers. So remember, this survey accessed a number of different types of providers. So we had licensed and license exempt providers, family-based and center-based settings, schools, Head Start, tribal. We need to make sure that we are tapping into all of those different providers and engaging in innovative approaches with the providers themselves with support of these existing resources. Parent engagement was also listed as a barrier, and so thinking about how to address this, utilizing existing principles and practices in early care and education, taste tests, or on-site market pickups. These are unique opportunities for families that might not have daytime availability. So sending home recipes or activities to share at home, these are ways that we can also increase family engagement opportunities, and hearing from multiple sites and multiple venues to see how they're engaging families and capitalizing on those opportunities feels especially important. So sharing that evidence-based practice is one way to think about how we can do this. So when we think about the implications for farm to ECE as a movement, in order to promote high quality and consistent future monitoring and research, leaders in the movement, such as NFSN and the Center for Regional Food Systems here at Michigan State University, we need to continue to develop and collaborate those relationships with federal and state agencies, as well as our national academic partners. So this was particularly evident in disseminating the surveys and noticing those differences and discrepancies across states and territories, especially due to that lack of a centralized distribution system. We also, that support and technical assistance that's been identified as an important approach to overcoming many of the noted barriers. That seems critical. We can increase access to resources and technical assistance, and stakeholders should continue to be encouraged to tap into national, like the National Farm to School Network, and state networks. We also know that future resource creation should be targeted at identified needs. So in the larger document that will be coming out in November, we can start to see what some of those needs are, but continued education opportunities for providers, family engagement tools, and procurement training, taking advantage of existing resources such as this survey, and also extant, although noted, limited in farm to ECE research. Strategic collaborative efforts, those things are vital to successfully to see these identified opportunities. We also know that the effectiveness of these endeavors has to be assessed with best practices and shared to enable wider implementation of farm to ECE. So strategic partnerships that include federal and state agency and academic partners to advance research, and think about advocacy and support organization to advance policy and support change in ECE culture is essential, but also the on-the-ground technical assistance for partners, including resource creation and that direct programmatic support, has to take place. And I know that was a lot for a discussion.
Great, thank you, Megan. Yeah, and I'm going to build on what Megan was speaking to and talk a little bit about what can we do to put these results to work, both at the national and state level. And as Megan said, this is a lot of information to digest. I want to note that I've linked the fact sheets and the infographic in that chat box if you want some additional visuals to help kind of digest the conversation that we're having. And please continue to add your questions into our question box as well. We're looking forward to a robust discussion with you about these results and how to use these results. So kind of wrapping this, bringing these pieces together to think about how we can put these results to work. And I think as Megan mentioned as well, is how can we utilize the results both at the national and the state level to inform our programmatic work and our policy advocacy work. By looking at these reported, speaking of starting with the motivations, the motivational piece that Megan mentioned, and we did look at motivations both for providers who are actively engaged in farm to early care and education and those who are getting ready to start, who are planning to start and why they want to start. And so if we can take those motivations and start to target our messaging to providers about those motivations, we can really help encourage and reach those providers who we haven't reached yet and encourage them to both start and continue engagement by capitalizing on those noted motivations. And then, as Megan mentioned as well, understanding those barriers is really vital as we move forward with both programmatic advancement and identifying policy priorities. If we can help focus and target our interventions and our resource creation and our efforts into addressing those specific policy barriers, we can really help make movement to both get providers started as well as continue their expansion, maybe taking them from just participating in a garden to participating in more educational activities, and in particular, overcoming those barriers to local procurement, which we found to be such a strong element of feedback that we heard from providers in the survey. Additionally, understanding those barriers, as we talked about, is really vital to us understanding our policy priorities and working towards advocacy that can help support increasing the quality of early care and education settings in general through farm to early care and education, and setting folks up for success in implementing farm to early care and education in those programs. We saw a lot of reported barriers in providers knowing how to find and connect with local producers. So what policies can we look at to help support those robust community food systems that can help increase access and connectivity to those local providers and producers? And of course, as we heard, cost often emerges as one of those barriers, both to the procurement aspects as well as the educational and gardening aspects. So what policies can we start to consider to promote and work on our advocacy around that can help address those cost issues, from potentially focusing on increasing CACFP participation and potentially reimbursement to help address that cost barrier of purchasing local food, as well as in the bigger picture, ensuring better fiscal support for early care and education systems to ensure that providers have both the staffing and the financial resources to implement these creative and high quality approaches to increasing quality. Additionally, we can use this information to help us understand our reach, both at that geographic level by type of early care and education, and also considering if we are appropriately reaching children and programs reaching children of color and in low-income communities. And we're doing some additional analysis to look if we currently are reaching children across the spectrum and reaching all types of early care and education settings. And that can really help us inform where we have those gaps, where we need to work on partnerships and where we need to work on resource development to ensure that we are reaching all children with farm to early care and education. One of our big priorities for this iteration of the Farm to Early Care and Education survey was to make sure that we had state level data. And again, that state level data is going to be fully released in November, so states can look at where they stand, and that information coming specifically from early care and education providers in their states. And we see that as an important opportunity for states to be able to really target and hone in on their own programmatic and policy efforts and meet the needs of the early care and education providers within their state. So utilizing that specific data, states will be able to look at those specific barriers, those specific motivations, and the actual reach within the different early care and education sectors and settings within their own states, and help formulate their own interventions that can be specific to the needs in their communities. Additionally, we see this data as really valuable, as many early care and education systems require a needs assessment, from Head Start to the new preschool development grant proposals that states are working on right now. They require that needs assessment to better understand what the needs are within the state and ensure that those systems are helping meet those needs. So by including nutrition and health and farm to early care and education data in that assessment, it can set up the state or the program to help incorporate farm to ECE into those interventions in the future. So it's important to have this data set and be incorporating into that, both into the proposals and the needs assessment themselves. And I'd like to mention that one of our fantastic partners, the Policy Equity Group and the BUILD Initiative, have created a new resource about the preschool development grants that I mentioned, highlighting how nutrition and health can be incorporated into that needs assessment component. And I do want to note that we do have some states that we did have some minimal response rate from, and some states that we did not get responses from. But I think we also can see that lack of response as an opportunity for advocacy in those states. For those states who weren't able to get strong data back, it really demonstrates the needs for stronger state level ECE connectivity and a way to be able to access early care and education providers in that state to both share and better understand their needs around professional development and farm to early care and education in particular. And we also, looking at this state level data, that gives that state who maybe doesn't have a strong response rate the opportunity to show comparable data from other states to demonstrate what's possible for their state and how they can grow. Megan, do you have anything else you'd like to add to putting those results to work?
I don't think I have anything to add, but I really like what you just said about the what's possible, and especially where we have that leveraging lack of response and that missing data. I think it's not necessarily that when we send out 64,000 emails and we have such a low response rate, it does speak to that opportunity. And so I know I just saw from the National Farm to School Network's newsletter that Wisconsin has done its own survey. I know that there are some other states that are looking to do their own surveys. And I think, again, there's that idea of what's possible and utilizing some of the survey questions for states to do their own work and to think about what they have in terms of needs assessments and how to leverage their own state level results to do more. And I like that idea of opportunity. So I think this is a great starting point because of the rigor of this methodology and being very mindful of who are we asking in terms of what they're doing and what they want to do and how to engage this work. So I like how you framed that. I think that's a really positive way to look at it in ways that we haven't necessarily been thinking about farm to ECE before.
Great, thanks, Megan. And I agree, I think we have a great opportunity to build on what we're learning and see where the future opportunities are. And we hope that the resources that we've created here, from our fact sheets to the infographic to the upcoming larger report and that state level data, will help people be able to move this work forward within their states as we use it to move at the national level as well. So with that, I'd love to get into some of our questions. And we've got a few coming in. As you do have questions, please enter those in the chat box, and Megan and I will aim to answer as many as we can. So let's get started. We have a question about the health behaviors of ECE professionals themselves. Do we have any insights on the health behaviors, especially eating healthy, by the ECE professionals themselves? Great question, and I think this is an arena that I think we'll see an increasing interest and need focus attention on. In this survey, we didn't focus on the ECE providers' behaviors or ask about them specifically, mostly because of the target of the survey, and it was a pretty long survey as it was, and so trying to limit how much we were asking of providers. But I think an important area to continue exploring, and we do know how important and what the opportunities are for Farm to ECE to help support providers in being that model for healthy behavior. So I think we'll see a lot of continuing interest, and thanks for bringing the issue up, but we did not focus on it in the survey itself. Megan, do you have anything you want to add to that?
No, I think that's a great question, and there is some research that looks at the relationship between provider health behaviors as well as parental behaviors and its effect, and role modeling for young children. But I agree with you, Lacey. The survey had 52 questions, and so survey fatigue is something we definitely wanted to be aware of, so it was not addressed in this particular survey.
Great, but certainly an area of interest, and we'd love to see more work in that arena. Another question about state data and if we've categorized by state. So again, it was a priority for us to be able to look at some of that state level and data and share it with our partners. When we do our release of the full report in November, we will also release some information about the states, and the states will each have their own tab within an Excel spreadsheet that they can look at that data, looking at this kind of higher level look at participation and motivations and barriers for each state. So we will be able to make that available to you when we release this in early November. And if you have specific questions about your state, please feel free to reach out to me. Megan, I'll turn this question over to you. Were food safety concerns mentioned as a perceived barrier in responses?
Oh, that's a great question. So food safety always comes up as a concern in terms of anecdotal. And so I'm hesitant to say without looking at the specific data. Lacey and I were talking before the call that there's so much data swimming around in our heads that to say definitively that if food safety was, I want to go back into the survey itself to make sure that I know the response before I say, hey, yeah, that totally was. So I'm trying to go back and see if it was. But I'm looking at it and I'm not seeing food safety specifically. So there is local or state policy restrictions as a potential barrier, and that was cited by 16.6%. So often it doesn't say food safety specifically, but local or state policy restrictions, food safety could be included in that. Just like limited staff knowledge about nutrition education, food safety could be included in that, but food safety is not listed specifically. So that's a yes, maybe answer, which I know is not helpful.
We did include it when we asked. It was one of the potential areas that they could have checked. It didn't emerge as one of the top, it looks like top 7 or so choices. It was about 8th on the list of concerns.
2, 3, 4, 5, 6, 7. Now I'm going backwards. 1, 2, 3, 4, 5, 6, 7, 8, 9. It's 10th actually.
Right, so I think that's a really interesting result that we found, is that it did not necessarily emerge as one of those top barriers. And that may be, you know, I don't want to speculate or hypothesize, but that may be because of the audience that we were looking at. We had about half of folks from family childcare homes, so they're working in a smaller kitchen. You know, it may just be a reflection of the audience that we were reaching.
And to be clear, food safety is listed as a barrier to purchasing and procuring. It's not listed under activities, and it's not listed under, yeah, so it's listed as procurement, not under activities, and those can be 2 separate spaces. So I'm thinking about that in terms of my provider hat, not as my food nutrition hat. And that those can be different areas.
That's a great point. Great. Our next question is, was there a comparison in rural versus urban providers? Megan, do you want to address that?
Sure. So again, for the purposes of this document, this is a largely descriptive document at this point, so we're not running any correlations or any, we're not looking at any relationships yet. So the data that's going to be reported is largely the number of providers or the number of respondents from a particular setting. So in terms of how many from which type of setting, and I'm scrolling up to that particular page. So if you wanted to know, like, if there's a relationship between participation in farm to ECE and rural versus urban, I don't even think we have that data yet. But, or is someone from a rural setting more likely to participate in farm to ECE? That we haven't predicted that type of data yet. So that's forthcoming. But in terms of, and this is for the entire sample, so 2030, 41.5% were from suburban, 29.4% were rural, 27.1% were urban, 1.5% tribal, and 0.5% did not provide that data. But again, that is the entire sample. This is not breaking it down by farm to ECE at this point, or participation in farm to ECE.
But I appreciate you bringing that up, and I will mention that we will be doing some additional analysis to help look and better understand kind of what the profile of early current education participation is and how it looks different from different types of setting. So please let us know what are those areas of interest that we should be considering as we do that deeper analysis as well. Next question we have about barriers, and Megan, I think you can speak to this as well, but the barriers that we faced in administering the survey in terms of lack of coordination and streamlining of information among different types of early care and education providers.
Okay, and I'm not sure I totally understand the question, so I might need some clarification. Is that in terms of sending this survey out?
I think the question is around, yes, how our challenges in being able to reach a broad range of different types of early care and education providers, and how does that speak to kind of the lack of coordination amongst early care and education systems in the state?
Well, and I think we started to address that a little bit in terms of when we initially tried to obtain emails. Some states have a fairly easy method of obtaining emails. So you contact either the Department of Education or licensing and ask for a list of emails, and they are happy to send it to you. Well, maybe not happy, but they're willing to send it to you. And so then we could plug that into our email dissemination system, and it would send out those emails through Qualtrics. Other states or territories do not have that same mechanism, and so we had to go through Child Care Resource and Referral or a differing agency, and they have sometimes multiple points of contacts or multiple emails. So maybe one state would have 10 regional Child Care Resource and Referral emails. We would have to send the email inviting participants to click on the link and participate in the survey, and it's hit or miss. So it's dependent upon that person actually sending out the email with the link to their list, if that makes sense. So on one case where we have the full list of emails, we sent it out, we know it went out to all of those emails. So maybe it's a list of 3,000 people, we sent it out, and I can see that all of those emails were distributed. In another case, for another state, I'm sending it out to 10 emails that are associated with Child Care Resource and Referral, or CCRNR to be shorter, and then I'm banking on the fact that they are then going to distribute my email invitation to those people, and those people are then going to not just say, oh, this is CCRNR, it's not just another training or not just something else that I don't need. So there's that coordination that just, I'm hoping for the best, crossing my fingers and toes and hoping that they all get it. If we had a central distribution list that was nationwide, and I don't know, even being in early care and education for 20 something years, I'm still unaware of any centralized distribution list that exists where every provider of all of the types that we've already mentioned is a member. And it's simply because they don't have to be. There's not any incentive for providers to be part of a national registry Most often providers are having to pay for all of those things, and so it's an additional cost to them. So we have no incentive, of which I'm aware, for providers to be on a national registry or a national listserv. And then thinking about that, the amount of the sheer volume of email that they would receive being part of this listserv, how do they wade through all of that on top of all of the things that they already do? And so I see both sides of this, but I'm hoping I'm answering the question, but that to me is probably one of the major challenges in early care and education. We have so many things that we are asking of childcare providers. How do they prioritize the things that we all feel that are important to them? And so they're saying that the health and well-being of young children is important, and I want them to fill out a survey that has 52 questions and it's going to take them 20 to 30 minutes and take time away from the children for whom they're providing care. So that feels really vitally important to think about.
Thank you, Megan. Yeah, I think our experience just really underscores that challenge that many of you know, working in the early care and education sector, of reaching early care and education providers directly, and the diversity of needs that we're trying to address at the same time. An important comment here, I think. A comment from Lori, she says, it may be important to have some of the same questions used with individual state surveys for research purposes. And I think that's a great point. And I think one of the a motivating factor for us to be doing this national level survey is to create some level of kind of shared measures. And so we do share this question list. We share the questions that we've established for this survey with states that are doing the same work, in hopes that we can create some of those kind of shared measures and be able to gather data over time that can be compared from state to state. So I think that's a really important question and note around how we can align this national level information gathering with state level information gathering as well. Jennifer asked, is there any data from Hawaii? And yes, Jennifer, we do have some data from Hawaii. I don't know can't pull the exact number up right now, but there will be data when we do release that in November, or feel free to reach out to me and I can let you know how many responses we got from Hawaii.
I feel like Hawaii should send us some sunshine in exchange for that data. Just putting that out there.
Just to be fair.
Yes. Just a photo would work.
Great. Next question. Those who listed cost as a barrier, did they indicate a % increase in purchasing local healthy food? And I'm not quite sure what the question, what the link in the questioning is, or if they're looking at kind of their potential % to increase. So we did ask both of those questions, but we haven't looked at a comparison yet that would look at folks who identified cost as a barrier, whether they actually plan to increase. So we don't have those kind of cross-analyzed yet, but we did look at both of those questions about the barrier of cost and those who plan to increase their local food purchasing. And I think that's what you're asking, but we haven't kind of cross-analyzed what those look like together. Next question is around the venue where local foods are purchased, and we did ask that question, and we asked it in 2 different sections. We asked about direct purchasing, and we asked about purchasing from intermediate sources. So kind of the top 3 direct purchasing sources that arose were farmers markets, obtaining from on-site or community gardens, and then individual farmers. So those were the top 3 direct sources of purchasing local foods. As far as intermediate purchasing, those top 3 were, again, we had a lot of responses of other, as Megan discussed. Distributors and grocery stores rose to the top of that list. Anything else you'd like to add about that sources of local purchasing, Megan?
No, I think you did a nice job of explaining it. What was really interesting from the perspective of the intermediate sources is that other was the write-in candidate, where even though, which we did talk about already, but the writing in was often the specific name of a grocery store or a distributor. And so that felt important, that they wanted to identify, it seemed like they wanted to identify the specific source. And they also identified food banks and school districts as part of that other.
Yeah, I find that reference to school districts as really interesting, because as we move forward and looking at kind of creative opportunities for procurement, that is one area that we would like to explore and promote for people, is looking at those partnerships with school districts and leveraging their purchasing power. So it's nice to see that some programs are leveraging that opportunity. Let's see, Molly asks about getting the list of questions. And Molly, if you want to connect with me, I can share the specific questions that we asked there. And Jennifer is very kindly sending sunshine and rainbows to all of us. So as we go into our late fall, early winter, we can definitely use all those sunshine and rainbows. So thank you so much, Jennifer. And those are all the questions we have right now. I want to thank everyone for being on the call. Megan, thank you so much for being here and your partnership in this survey development and implementation. As you do have questions, please feel free to reach out to myself and Megan. Our contact information is there, and we'd be happy to share more information. Again, the survey report as well as the state level data will be released in early November. Those fact sheets and infographics and social media graphics are all available now, and you'll receive that link in a follow-up email in a couple of days here, along with the recording of the webinar. So thank you all for spending your time with us. We hope this is a valuable tool for you to help promote farm to ECE in your communities and your states. And please connect with us and let us know how you're using the data and how it's been helpful to you. So thank you again, Megan, for being here and your partnership in this work. And we'll look forward to connecting with all of you on the next webinar, and hope everyone enjoys a fantastic rest of your National Farm to School Month.
Thanks, Lacey. Thanks everyone for joining us.